Around 7 million people worldwide die from heart attacks each year. Heart disease, which causes heart attacks and strokes, is the top killer globally. So what exactly causes a heart attack? Just like any other muscle, your heart needs oxygen. During a heart attack, it can't get enough. Over time, fatty deposits called plaques build up on the inside walls of your coronary arteries. These are the blood vessels that deliver oxygen-rich blood to your heart. These plaques grow as we get older, sometimes getting big, hard, or inflamed. Eventually, they can create blockages. If a plaque breaks open or cracks, a blood clot quickly forms around it. What was once a partly blocked artery can then become completely blocked. When this happens, blood flow to the heart muscle stops, and the oxygen-starved cells start to die within minutes. This is what we call a myocardial infarction, or a heart attack. Without treatment, things can go downhill fast. The damaged heart muscle might not be able to pump blood as well, and its rhythm could get messed up. In the worst-case scenario, a heart attack can even cause sudden death. How do you know if someone is having a heart attack? The most common sign is chest pain, caused by the heart muscle not getting enough oxygen. People often describe it as a crushing or vice-like feeling. This pain can spread to the left arm, jaw, back, or stomach. But it's not always as sudden and dramatic as you see in movies. Some people might feel sick to their stomach or short of breath. For women and older folks, symptoms might be less obvious. They might just feel weak and tired. Surprisingly, many people, especially those with diabetes, which affects pain-carrying nerves, might have what's called a silent heart attack with no clear symptoms at all. If you suspect someone is having a heart attack, acting fast is key. If emergency medical services are available, call them immediately. That's the quickest way to get to a hospital. Taking aspirin, which thins the blood, and nitroglycerin, which widens arteries, can help stop the heart attack from getting worse. At the emergency room, doctors can figure out if it's a heart attack. They usually use an electrocardiogram, ECG, to check the heart's electrical activity and a blood test to see if the heart muscle is damaged. Then the patient is taken to a special cardiac area where tests are done to pinpoint the blockages. Cardiologists can open up blocked arteries by inflating a balloon inside them, a procedure called an angioplasty. Often, they'll also put in a metal or plastic tube called a stent to keep the artery open. If the blockages are more widespread, coronary artery bypass surgery might be needed. In this surgery, doctors use a piece of vein or artery from another part of the body to reroute blood flow around the blockage. These procedures restore blood flow to the heart muscle, helping it work normally again. While heart attack treatments are getting better, preventing them is still super important. Your genes and your lifestyle both play a role in your risk. The good news is you can change your lifestyle. Regular exercise, a healthy diet, and losing weight all lower your risk of heart attacks, whether you've had one before or not. Doctors suggest exercising a few times a week, mixing in both cardio and strength training. A heart-healthy diet is low in sugar and saturated fats, which are both linked to heart disease. So what should you eat? Lots of fiber from veggies, chicken and fish instead of red meat, whole grains, and nuts like walnuts and almonds all seem to be good for you. A good diet and exercise plan can also help you stay at a healthy weight, which further lowers your heart attack risk. And of course, medications can also help prevent heart attacks. Doctors often prescribe a small dose of aspirin, especially for people who've already had a heart attack and those known to be at high risk. Medications that help control things like high blood pressure, cholesterol, and diabetes will also make heart attacks less likely. Heart attacks might be common, but they don't have to be something that definitely happens to you. Eating healthy, not smoking, staying fit, getting enough sleep, and having lots of laughs all go a long way in making sure your most important muscle keeps beating strong. Know your risk factors. Understanding your risk factors for a heart attack is the first step in preventing one. Some risks, like age, family history, and genetics, can't be controlled, but many others can be. For example, smoking, high blood pressure, high cholesterol, and diabetes are all major contributors to heart disease. If you have any of these conditions, it's crucial to manage them with the help of a doctor. Regular checkups and screenings can help catch these issues early, preventing them from escalating into something more serious. Knowing your cholesterol levels, blood pressure, and blood sugar is important so you can take steps to keep them in check. Know your risk factors. Understanding your risk factors for a heart attack is the first step in preventing one. Some risks, like age, family history, and genetics, can't be controlled, but many others can be. For example, smoking, high blood pressure, high cholesterol, and diabetes are all major contributors to heart disease. If you have any of these conditions, it's crucial to manage them with the help of a doctor. Regular checkups and screenings can help catch these issues early, preventing them from escalating into something more serious. Knowing your cholesterol levels, blood pressure, and blood sugar is important so you can take steps to keep them in check. Manage stress for heart health. Chronic stress is linked to higher levels of cortisol, a stress hormone, which can increase blood pressure and contribute to the buildup of plaque in the arteries. Managing stress through techniques like meditation, deep breathing exercises, or mindfulness can help keep your heart healthy. Regular physical activity is also an excellent way to reduce stress levels. In addition, ensuring that you have a good work-life balance, taking time for hobbies you enjoy, and surrounding yourself with supportive people can help you manage stress more effectively. Don't overlook your mental and emotional well-being as part of your heart health journey. Stay hydrated and limit caffeine. While drinking water is essential for overall health, it's also crucial for heart health. Proper hydration helps your heart pump blood more easily, reducing strain on the cardiovascular system. On the flip side, excessive caffeine intake can raise blood pressure and stress levels, contributing to heart disease risk. Limiting caffeine and opting for herbal teas or water can help reduce your risk of heart-related problems. Keeping track of how much caffeine you consume daily is a good way to ensure you're not overloading your system with a stimulant that could negatively affect your heart. Regular health screenings. Even if you feel fine, regular health checkups are key to heart disease prevention. Blood pressure, cholesterol levels, and blood sugar can all be monitored during routine doctor visits. Catching problems early can lead to more effective treatment and prevent serious complications later on. If you're over 40 or have a family history of heart disease, talk to your doctor about how often you should have these screenings. Early detection can make a significant difference, as lifestyle changes or medications can often manage risk factors before they become life-threatening. Sleep and rest are essential. Good sleep is more than just a luxury. It's an essential part of maintaining a healthy heart. Sleep deprivation has been shown to increase the risk of developing high blood pressure, diabetes, and obesity, all of which can contribute to heart disease. Aim for 7 to 9 hours of quality sleep each night. If you're having trouble sleeping, consider creating a calming bedtime routine, reducing screen time before bed, and ensuring your sleeping environment is comfortable and quiet. Good sleep helps the body repair and recharge, which can lower stress levels and contribute to better overall cardiovascular health. Importance of a heart-healthy diet. A balanced diet plays a crucial role in preventing heart attacks and maintaining overall heart health. Foods rich in fiber, healthy fats, and antioxidants help reduce cholesterol levels, lower blood pressure, and prevent artery blockages. For a heart-healthy diet, focus on eating more fruits, vegetables, whole grains, and lean proteins like chicken, turkey, and fish. Nuts such as walnuts, almonds, and seeds are great sources of healthy fats that support cardiovascular health. Avoid foods high in saturated fats, sugar, and trans fats, which can increase your risk of heart disease. Olive oil and avocados are examples of heart-healthy fats that can be included in your daily meals to improve cholesterol levels and overall heart function. Happiness and mental health. Did you know that happiness is directly linked to heart health? Studies show that positive emotions can improve heart function and reduce stress, which is a major contributor to heart disease. Stress leads to higher levels of cortisol, a stress hormone, which increases blood pressure and can contribute to the buildup of plaque in your arteries. On the flip side, laughter, joy, and relaxation reduce cortisol and promote better blood flow. Finding happiness in daily life, whether it's through spending time with loved ones, pursuing hobbies, or practicing gratitude can be a simple but powerful way to protect your heart. Prioritizing mental health and taking time for activities that bring you joy not only reduces stress, but also strengthens your overall well-being.